Americans borrowed an estimated $88 billion over the last year to pay for healthcare, according to a survey released on Tuesday by Gallup and the nonprofit West Health. The survey also found that 1 in 4 Americans have skipped treatment because of the cost, and that nearly half fear bankruptcy in the event of a health emergency. There was a partisan divide when respondents were asked whether they believed that the American healthcare system is among the best in the world. Among Republicans, 67% of respondents said they believed so. That number was 38% among Democrats, but Democrats and Republicans had similar responses about putting off medical treatment. Asked if they had deferred treatment because of the cost, 27% of Democrats said they had, compared with 21% of Republicans and 30% of independents. President Trump retreated on health care Tuesday, saying a GOP plan would appear after the 2020 election. Respondents from across the political spectrum also reported pessimism about their leaders' abilities to reduce healthcare costs. About 70% of respondents said they had no confidence in their elected officials to bring prices down, and 77% said they were concerned that rising healthcare costs would damage the American economy. "Our data shows an American public that's beaten down from this really serious issue," said Dan Witters, a senior researcher at Gallup. At the same time, 64% of respondents said they were mostly satisfied with their experiences in the healthcare system. When asked if they were satisfied with how well the system was serving Americans generally, only 39% said they were. Sign up for parenting from the team at NYT Parenting, launching soon. Get the latest news and guidance for parents. We'll celebrate the little parenting moments that mean a lot and share stories that matter to families. The survey's authors noted that Americans' feelings were complicated and at times conflicted. But one thing was clear: high healthcare costs had created significant anxiety. Even among households earning $180,000 or more a year, a third of respondents said they were concerned about the specter of personal bankruptcy because of a health crisis. There has been fierce debate among researchers about the extent to which health care costs can be blamed for bankruptcies. Many American families earning less than that, of course, feel the effects of high health care costs acutely. They are forced to cut back on other expenses to pay for health care, or skip appointments and prescription refills, creating health risks down the road. 12% of respondents said they had borrowed money for care, including 11% of those with health insurance, who may still face high deductibles and other out-of-pocket expenses. Most survey respondents said they believed that Americans were paying too much for health care relative to what they receive. Asked to choose between a hypothetical freeze in their health care costs or a 10% increase in household income, 61% of respondents chose the freeze. Those in low-income households were most likely to choose that option. When we're talking about healthcare and the debate right now, it usually bifurcates between the financial impact of healthcare or the health outcomes themselves, said Tim Lash, Chief Strategy Officer for West Health, a nonpartisan nonprofit that aims to lower healthcare prices. But those two things intersect at access, which can have dire health consequences, he said. The organization believes that Congress should allow Medicare to negotiate directly with drug companies. That there should be more transparency about the prices of medicines and procedures. And that the healthcare industry should shift toward value-based care in which doctors are paid based on patient outcomes rather than the current fee-for-service model. Editor's picks: Can what we eat affect how we feel? At 71. She's never felt pain or anxiety. Now scientists know why. It's possible leggings are the future. Deal with it. Mr. Lash noted that other wealthy countries spend much less on health care than the United States does, while achieving better outcomes in areas like life expectancy and infant mortality. Although about 87% of Americans have health insurance, according to data from Gallup, an individual's plan may not cover all costs associated with treatment. President Trump, who has sought to undo the Affordable Care Act, tweeted about high deductibles under the law on Monday morning, promising that good things are going to happen. And tagging several Republican lawmakers. The administration asked a federal appeals court to invalidate the law last week, while Democrats announced a health care bill that builds on the Affordable Care Act and seeks to lower premiums, among other goals. The partnership between West Health and Gallup, the analytics and consulting company, was a first. The survey results are based on phone interviews conducted in English and Spanish in early 2019 with a random sample of 3,500 adults across the country. The margin of sampling error ranged from 1 to 2 percentage points for results based on the total sample, and 3 to 5 percentage points for results based on subgroups such as political identity or income level, so differences of less than those amounts are statistically insignificant. Gallup and West Health said they would conduct similar surveys in the coming years.